and good afternoon. It is Friday, and that means it's time for our regular Lunch and Learn. Now, today we're going to be talking about aspirin. I know, right? The lowly little aspirin and how it can benefit us as pertains to cancer. Now, holistically, in holistic world, we know that taking a baby aspirin every day is maybe not all it's cracked up to be. We'll get to that in a minute. More research has come out, and they were recommending that people with heart issues take a baby aspirin every day, but they found out that taking a baby aspirin every day can lead to macular degeneration and also stomach ulcers. However, new research has come out, and I think that we need to look at the research and think maybe, well, if we take the aspirin, we're at these risks, but what else could we do to mitigate those risks? So that's kind of where I'm coming from. If someone had told me that I had cancer, I probably would do this therapy because the statistics are so extraordinary. But I would protect my eyes and I would protect my stomach in other ways. So kind of be open to this, because most people think that aspirin is an analgesic and you take it when you have a headache or you have aches and pains, sore muscles, and that kind of thing. You take it, it has blood thinning properties, and so the doctors don't want you taking aspirin before you come in for surgery. All that's true. And then they have, up until recently, it had been a pretty much daily occurrence that if you had heart issues, they would want you to take a baby aspirin every day, which kind of has changed based on new research. But this is even newer research, so I always like to bring you cutting edge things. So aspirin, we all know what aspirin is. We probably have a bottle of aspirin somewhere, or we have a synthetic derivative of ibuprofen or something like that. But what has been found in a recent study, it indicates that cancer patients who took low-dose aspirin daily experience a 21% reduction in mortality. That means that they are almost 0.25% less likely to die, okay, which is a lot. That is a lot. There's also evidence of aspirin's role in preventing cancer metastasis. Now, metastasis is where you have a lump, you have a tumor, and then it grows, spreads, travels, moves throughout the body, and so you may have had cancer in one particular area of the body, but then we find out that it's in the bones or it's traveled or whatever it is. That's called metastasis, all right? They also call it metastatic cancer. And what they found in this research is that if you take an aspirin, it can reduce metastasis. And everybody that has cancer does not want metastasis. Nobody wants that. So cancer is one of the leading causes of global mortality. That means you're going to die from it. And it's one of those things that I looked at the statistics, and men have a 42% chance of developing cancer in their lifetime. Women have a 39%. So it's almost equal. We don't want to develop cancer, so anything that we can do to not develop that is a good thing. We want to make sure that we eat well, we rest well, we live well, we don't do, negative behavior, smoking, drinking, drama, all that kind of stuff, all right? So when they reviewed in 2020, there was 19.3 million new cancer cases worldwide, almost 10 million deaths. According to the statistics, 1 in 6 reported death is related to cancer. The most common cancer is breast cancer, lung cancer, colorectal cancer, prostate cancer, and stomach cancer. I didn't realize stomach cancer was that high on the list. In November in 2023, researchers from Cardiff University in Wales published an extensive review by the British Journal of Cancer outlining aspirin's potential to reduce cancer mortality, prevent metastatic cancer spread, and to minimize vascular complications. Now, they don't tell me exactly in this report what that means, but when you have cancer, you have a tumor, it will grow its own vasculature to make sure that it has the nutrients and the oxygen it needs. Well, that's not quite true because it grows in an anaerobic environment, but to make sure that it's got the nutrients it needs in order to survive. And so aspirin helps with this vasculature, but they don't tell me exactly what that means. The study compiled results from 118 observable studies involving about 1 million cancer patients. So this is a lot of people. It revealed that a daily intake of low-dose aspirin, so that's 75 milligrams to 81 milligrams, was associated with a 21% reduction in all-cause mortality. In a study involving pancreatic cancer, patients who were undergoing surgery indicated that patients that took an aspirin had a 3-year survival rate of 61.1% as compared to 26.3% of those that didn't take it. So that is a statistically significant number of adding a vitamin to your regimen if you have this kind of cancer. So the primary mechanism of the aspirin is that it inhibits the COX enzyme. Now, COX is an acronym for this big long word that I'm not even going to try and say, okay? COX is responsible for forming prostaglandins, which is a critical pathway in cancer signaling. However, the anti-cancer effects of aspirin extend beyond this. Research says that aspirin's mechanisms of anti-cancer action also involve energy metabolism associated with cancer cell proliferation, cancer-related inflammation, and platelet-driven pro-carcinogenic activity. So aspirin does a lot of things to push these other mechanisms down so the cancer doesn't have the strength that it needs, the energy that it needs, and the ability that it needs in order to proliferate. So this is a really, really good thing if you've got cancer. The metastasis or spread of cancer is a major cause of death in cancer patients, and platelets play a significant role in this process. So you may know what platelets are, you may not know. So platelets are part of your blood. You've got your red blood cells, your white blood cells, and your platelets. Now, platelets can clump together, right? And that's called aggregation. We don't want to see platelet aggregation. Now, when we do live blood cell analysis here in the clinic, we see aggregation a lot. Okay, so what does that mean? That means that there's something sticky in the blood that causes the platelets to stick together. When they stick together, they can form clumps, they can form clots, they can do all that kind of stuff. And aspirin inhibits those platelets. That's why I said earlier, when you're going in for surgery, they usually tell you not to take your aspirin because aspirin has blood thinning abilities and they don't want you to do that. This journal, this comprehensive review in the journal, found that aspirin can lower the risk of cancer metastasis by 38% to 52%. So again, that is a significant statistic that you may be able, by taking an aspirin, to slow or reduce the metastasis by 50%. So that's amazing. They tell us additionally that aspirin plays a role in DNA repair, which kind of goes against everything that I have heard about aspirin with the macular degeneration and the ulcers and that kind of thing. But they are finding, and new research is always good, they're finding that errors that occur in the DNA as we get older, you may know it as protein misfolding, all right, because DNA is a protein. When it misfolds, you get a mutation. The more mutations you get, the less comprehensively your body's going to work, right? So they're saying that this aspirin repairs and helps preserve the replication of the DNA. And once that is compromised, the misfolding of the proteins, it can lead to the development of cancer. Research has demonstrated that an aspirin can enhance DNA repair mechanisms, therefore preventing hereditary non-polyposis colorectal cancer and potentially other cancers as well. So, as I said, aspirin is a little bit controversial. All right, so they addressed this. They said that the role of aspirin in cancer studies remains controversial, primarily because of the bleeding risks, which we talked about. In a study published in The Lancet in 2017, it suggested that daily aspirin caused 3,000 deaths from bleeding in Britain every year. However, there were no control groups in this study. So the researchers point out that the increased risk of bleeding in elderly and frail patients does pose a real danger. However, instead of solely focusing on the frequency of bleeding, greater consideration should be given to its severity, as the most severe instances of bleeding are the ones that are responsible for the deaths. So the researchers consolidated data from reports from 11 different randomized controlled studies encompassing more than 100,000 participants that included fatal bleeding events. The data indicates that 55% increase in the risk of bleeding because of aspirin. So the concerns are real. You do have a higher incident of bleeding if you take an aspirin every day. However, among the patients who experienced bleeding after taking an aspirin, only 4% died. In contrast with the control group who took a placebo, they had a death rate attributed to bleeding of up to 8%. So this suggests that the bleeding that is associated with aspirin is very, very minor, and you can do other things to mitigate that. One is being aware, being mindful, and that kind of thing. But there's other things that I think that you can probably do to help your body do compensatory mechanisms, because that's what the body does, right? It sees that there's a problem over here, so it compensates by doing something over there. So they conclude that a daily aspirin, the complication of bleeding is relatively mild. The conclusion drawn by the researchers is that considering a relatively safe dose of aspirin should be considered as a preventative measure for cancer. While there's evidence indicating that cancer can reduce the spread of metastatic cancer, and starting aspirin early can enhance its effectiveness against the cancer, more randomized trials are needed. Now, Peter Elwood, who is the honorary professor at Cardiff University, said in a statement that, quote, given its relative safety and its favorable effects, the use of aspirin as an additional treatment for cancer is fully justified. He added that it was very widely available and fairly inexpensive. And if you've ever dealt with somebody in your family that has had cancer, and I have, we find that it is extremely, almost prohibitively expensive. And so if this is something that we can do safely, and it can help prevent cancer, or if we already have cancer, it can stop the metastasis, it might be something that we look for. There was a comprehensive review in the journal called Annals of Oncology in 2020 that indicated that patients who took aspirin have a relatively lower dose of developing various kinds of cancer. The researchers conducted a comprehensive analysis of all observable studies on aspirin and digestive tract cancers published until March of 2019, encompassing more than 150 cases. So that's a lot. And remember, one of the things in holistic world that we don't want you doing aspirin every day is because of ulcers, and we know that ulcers left untreated can progress into cancer. So we know this. So you got to take all the facts, all the things. We know that when people get esophageal cancer, so your esophagus is from, your windpipe down to your stomach, right? When you have acid reflux and that kind of thing, it can burn off that mucosal lining. You can get lesions on your esophagus. That turns into a syndrome called Barrett's esophagus, which then turns into esophageal cancer if you don't get it treated. So we know that digestive issues, ulcers, and that kind of thing, and your digestive tract goes from your mouth all the way to your bottom. You've got your esophagus, your stomach, your small intestine, your large intestine. You've also got your ancillary organs, your pancreas, your liver, your gallbladder, all that. They all work together to help you with digestion. So when one thing goes wrong, a lot of other things can go wrong. And so when they did this, they looked at all this data, aspirin and digestive tract cancers, 150 cases. The results revealed that compared to patients not using aspirins, those that regularly took an aspirin had a 27% reduced risk of colorectal cancer, a 33% reduced risk in squamous cell esophageal cancer, a 39% reduced risk of adenocarcinoma of the esophagus and gastric cardia, and a 36% reduced rate of stomach cancer, a 38% reduced risk of hepatobiliary tract cancer, that's your liver, your gallbladder, your pancreas, and then a 22% reduced risk of pancreatic cancer, right? That's a lot. That's a whole lot of prevention and protection that a low-dose aspirin can give you. And so if you have these cancers in your family, and I do, it might behoove us to do a low-dose aspirin, of course, checking for bleeding and making sure you do a good eye vitamin and making sure your digestive tract is all good. You know, you've got to pay attention to all the things. But if you have cancer in your family, and if this aspirin will give you almost 40% less chance of developing it, I think we'd be a little bit foolish not to take that. And so it's something to think about, okay? We know pancreatic cancer is one of the most vile cancers that you can get, and it's really hard to turn around. Taking an aspirin gives you a 22% reduced risk. That's a lot, all right? In this study, they found no significant reduction in risk for head or neck cancer. So for colorectal cancer, which is a very prevalent cancer, taking a daily dose of aspirin, 75 milligrams to 100 milligrams, can reduce the risk by 10%, while a daily dose of 325 milligrams can reduce the risk by 35%. That's a lot. So you need to look at these statistics, and if this pertains to you, or if this pertains to anybody that you know and love, then you just might want to be, thinking about what do we do about all this information. So aspirin is very common. It's very cheap. We probably have it in our home somewhere. I had the occasion to go through a box that I have. It is it's about this big by about this big. It was something that I bought right after my son was born, and he's now in his 40s, right? So I've had it all this time. We used to keep all the baby things in there, but as my babies got grown, we now use that as our first aid box. And I was looking for something, and I was going through the first aid box, and I found all these different things. And I found a bottle of calamine lotion that I mean, it was ancient. You could just tell by the label, it was just ancient. But I also found aspirin in there. Now, do I take aspirin? No, I do not take aspirin. Why do I not take aspirin? Because I do not want macular degeneration. I do not want stomach ulcers and that kind of thing. And I take different herbs that are anti-inflammatories, and they have analgesic properties and different things when I need them, which is hardly ever, but when I do, I've got holistic things that I can take. So in the bottom of everybody's medicine cabinet or medicine box or whatever you have, you probably have a bottle of aspirin there, and that's something that you might want to think about doing if colorectal cancer is in your family. So an aspirin, they give you aspirin if you are a heart patient because it can reduce your risk of heart attack, and so that's another reason why they take it. However, it's essential to note that long-term use of aspirin may pose additional risk for some individuals. According to the UK National Health Service, children younger than 16 shouldn't take aspirin without a doctor's prescription, since there is a potential link between aspirin and Reye syndrome. So I've got to tell you this funny story. So my late husband was English, and when we first got married, we lived in Scotland. My son was born in Scotland, and then we came back here to the United States, and then my daughter was born here, and then we moved back to England. So we lived in Scotland, and we lived in England. And so when we lived in England, that was back in the day when they still made house calls. Don't remember exactly what was going on, but one of the kids was not feeling well, so I called the doctor, and he came to the door, and he made a house call, and he did whatever he did. And I don't even remember what the issue was. It wasn't anything drastic for sure. And as he's leaving, he's saying to me, he said, "Don't give the children aspirin." And I looked at him. I said, "Oh, I'm aware of the risk of Reye syndrome." His eyes got big, and he just looked at me and goes, "How do you know that?" And it's like, because I'm an educator, and I read, and I do all the things that all the smart people do. But it was so incredulous because he looked at me like I had just grown another head, that was sacrosanct information that nobody who didn't have a medical degree would know. And so anyway, it's just a funny story about Reye syndrome, but we do not want to give children aspirin under the age of 16. And I know that there's a lot of people out there who give their kids different anti-inflammatories and that kind of thing to reduce a fever. And I would just encourage you to think twice about doing that. A fever is the body's natural response to a pathogen. So if it's a bacteria, if it's a virus, the fever is the body's natural response to that. It burns it up. It kills it. And so when we give our children any kind of analgesics to bring that fever down, then we're not allowing the body to do what it needs to do to get that pathogen dealt with. Now, obviously, we pay attention. We do cool baths. We might do an alcohol bath. We do different things to try and keep that fever down. Definitely, if it goes over 103, we definitely want to have medical intervention. So, hear the whole story. But if you've got a 99.9 or 102, I wouldn't really worry about that too much. Yes, they're going to be cranky. Yes, they're going to have all these issues. But that is the body's natural response to a pathogen. So we want to make sure that if we do want to intervene, we definitely don't want to do it with aspirin, okay? So for individuals with a history of an allergy to aspirin or similar pain relievers, stomach ulcers, high blood pressure, indigestion, heavy menstrual bleeding, recent stroke, asthma, lung disease, blood clotting problems, liver or kidney problems, and gout, it is essential to talk to a doctor before taking aspirin. You don't want to take any kind of aspirin if you've got any of those conditions. So you want to make sure that while this report is really interesting about preventative measures for cancer, and I'm all about that. I'm all about preventing, okay? We want to make sure that we're not hindering something else. So make sure that you talk to your doctor about all these things so that you can make your best story there, your best options. So prophylactic aspirin used in adults over the age of 70 is potentially harmful, primarily due to the advanced or increased risk of bleeding in that age group. So you want to keep in mind that there is that. However, you got to balance it out with the rest of the story. Most people over 70 are in ill health. Most people over 70 are already taking anywhere between 5 and 13 different medications. Those are the statistics. That's what I see coming into my clinic every day with older people. So when you're typically dealing with an older person, you're not typically dealing with a healthy person. So keep that in mind. There are the unicorns out there, and I happen to be married to one, or maybe he's the unicorn because he's married to me. He's not on medications, and he's very healthy, and no one would know that he is, as old as he is, because he doesn't look as old as he is, and he doesn't act as old as he is because he's really, really healthy, all right? So you've got to look at the whole picture. So when you're dealing with the average 70-year-old, you're dealing with people that are not healthy in the main. Low-dose aspirin nearly doubles your risk for gastrointestinal bleeding if you are already not well, all right? In adults younger than 40, there is insufficient evidence to risk taking routine aspirin, all right, as a primary prevention for heart disease. While aspirin is still recommended for people with heart disease to lower the risk of another heart attack or stroke, previous studies have cast doubt on the effectiveness of this approach as well. And that's why the doctors are now saying, or they're now not saying, do a low-dose aspirin if you are at risk of heart attack, because new research has come out to say that it's not all that in a bag of chips. So you have to look at all the different things, So if you are healthy, if you have a good nutrient uptake, if you know that you're getting all of the things that you need so that your body can do all that it needs to do, and one of the ways we do that is we look at your carotenoid score with this little device. Now, this is called a PS3 scanner. It's got a laser right there. You put your hand, the heel of your hand right here on that laser, and within 30 seconds, it will tell you what your nutrient uptake is. So it's on a scale of 10,000 to 90,000. And we have had people that have come in and their score is minus 10,000. That means they're not having very much nutrition at all. And our goal is, through the vitamins that this company makes, that are guaranteed to be absorbable and your body can use them. They're made of antioxidants, which is what the carotenoids are. It's antioxidants. They take those vitamins for 90 days, and guess what happens? Their score goes from wherever it is on the scale. We'll say it's in the red. It can go all the way up to the other side, which is the purple, which is optimal. So if you're going to take an aspirin as a preventative, what you want to do is make sure that your nutrient uptake is sufficient to maintain the integrity of your organs. How do we maintain the integrity of our organs? It's because we eat good food. We don't indulge in harmful practices, smoking, over drinking, negative drama in our life, all those kind of things wear us down. And so if we're doing all the good things that we're doing, we're going to have that tissue integrity that a low-dose aspirin probably isn't going to give us a whole lot of problem. So just make sure that you're doing all the right things. And then if you want to add this aspirin to the regimen, that might not be something that's going to be very detrimental to you, all right? Aspirin alternatives include nattokinase and lumbrokinase, both of which are potent thrombotics compared to aspirin without the serious side effects. So, and I like this, and we recommend this here in the clinic. Now, both of those, there's serrapeptase, nattokinase, and the other one, lumbrokinase. They're all made from the enzymes. Enzymes is the word I'm looking for. Enzymes of the Japanese silkworm, right? I know nobody wants to eat a worm, but I'm just telling you, if you've got blood clot issues, if you've got fibrin issues, if you need to have a natural blood thinner, this would be a much better choice because it's not going to give you the macular degeneration. It's not going to give you the ulcers. It's not going to give you the esophageal issues and that kind of thing. So just kind of find out where you are. There are other things that you can do to maintain your health. And I'm just going to tell you, if you have a really good diet full of antioxidants, you're probably not going to get cancer anyway. You're just not going to. Why is that? Because when your body absorbs all the nutrients that it needs, then it has all the protection that it needs to thwart any kind of pathogenic activity. So I always like to say, back in the day, Star Trek, right? The Enterprise is, flying through space and it sees the Klingons coming this way. And so whoever was, at the helm there would say, put up the cloaking device. And so the cloaking device would go up and then you would see the Klingon, weapons just, they're hitting the wall and nothing's happening, right? That's where your body is with your antioxidants and your nutrition. When you've got that nutrition in there, you could be exposed to whatever you're exposed to, but you've got that cloaking shield so it just falls off. And I've told you this before, but I'm telling you again, just in case we've got new people that are listening. Back in the day, about 4 years ago, there was this horrible thing that was going around. Can't say it because YouTube will say that I'm going against community standards, so you guys just have to pay attention. Anyway, there was this horrible thing that was going around, and people were very afraid, and people were staying home, and all those kind of things. We, here at Abundant Health and Wellness, did not worry about that. Why? Because we keep our antioxidant level at a high level. We also made sure that we were taking antiviral herbs and preparations so that if into our field, something would come, we would have the nutrients that we needed to capture that, deflect that, whatever kind of analogy you want to use. And we never got sick. I mean, my husband and I never got sick. And we've had people as close as you and I are right now with full-blown infections. And it just didn't touch me. Now, why is that? Is that because, I got all this special power? No, not necessarily. It's because I eat well. I take absorbable vitamins. And if I'm going to be in a high target area, I do a maintenance dose of anti-infectives, antiviral. So when something comes into my field, my body is equipped, my immune system is equipped, it recognizes it, and it just doesn't have any kind of penetration ability. And so that's what you want. So good nutrition, good vitamins, and I'm not talking about the vitamins you get at the big box store because those are not doing anything for you. We have people that come in with laundry baskets, and yes, plural, laundry baskets full of supplements that they've ordered off the internet, and they're sick as a dog, and they don't know why because they've spent all this money on these supplements. You need to have a practitioner. You need to be scanned. You need to see what your body is asking for, because when you supply that, you're not going to run the risk, or your risk is going to be much, much lower of getting any kind of pathogen or running the risk of cancer. Now, again, listen to all the things that I said, because I said a lot of things. I said pro on this hand, con on this hand. So you have to kind of put it together and find out what works for you. But if you have these kind of cancers that are in your family, and if you are healthy, it might be something that would be beneficial to help you reduce your risk of contracting these hereditary cancers. So that's a lot. It's the weekend. I want you to enjoy yourself. I want you to do a lot of self-care. I want you to rest, recover, be ready to fight another day, because Monday's coming, and I'll see you next week. Thank you for joining me. Thank you for liking. Thank you for sharing. Thank you for commenting. Thank you for doing all the things that you do. And thank you for honoring me with your presence today and every Friday.